Nikita. Welcome you in Pharma online lecture series. Today we are going to see liquid dosage form. So on my screen you can see many containers. The liquid formulations are this is a drop bottle, then down you have an ampule, you have liquid filled injection, then you have some narrow mouth bottles here, and these narrow mouth bottles containing liquid, oral liquid, topical liquid. So these are the various different types of liquid dosage form. As you know, what is the dosage form? The dosage form is the form in which the drug is given to the patient for administration. So, as it is, you cannot eat the drug or you cannot apply the drug. You have to convert it into the suitable form having accurate drug content in a stable way giving to the patient for administration. So when drug is either dissolved or in dispersed form in a suitable liquid, suitable vehicle, suitable solvent, it is the liquid dosage form. So you can see here many different forms of the liquid dosage form. A solution is there, or you can say syrup, then some oral drop is there. This is the nasal drop or eye drop or ear drop. Then you have an ampule, and you have here the vials in which the liquid dosage form can be given to the patient. Now, this liquid dosage form is either prepared by dissolving or by dispersing or suspending or by emulsification method. So if your drug is having good solubility and it has less compression property, you can formulate your drug as a liquid dosage form. So based upon solubility of drug and other excipients, you can dissolve it in the suitable solvent or vehicle, and you can give it as a solution form. If your drug has a good solubility but it do not undergo compression, then you can prepare it as an suspension form where the drug is suspended or dispersed in a suitable vehicle or liquid and given as a suspension form. Then many oil-based drug or many oils can be formulated as an emulsion where both aqueous and oily phase are mixed with the help of emulsifier, and the emulsion based liquid dosage form can be prepared for the patient. So if you see what are the different advantages and disadvantages for the liquid dosage form. First is easy to swallow. As it is liquid dosage form, it is very easy to swallow. Even you do not need a water to swallow the dose. And it is easy for pediatric and geriatric patient. For kids and old age people, it is difficult to swallow big size tablet, big size capsule or powder which is in greater quantity. But the spoonful of liquid is very easy to swallow for the old age patient and kids, and hence it is most friendly and more acceptable for pediatric and geriatric patients. Then administration, as you know, the liquid dosage form are also the conventional and convenient to administer. If it is oral, you have to give it to the oral cavity. If it is to introduce into any body cavity, you have to just instill the drop into eye, ear, or nose. If it is for topical application, you have to apply it onto the skin or wherever it is applicable. So they are easy to administer, but for the parenteral, the liquid dosage form which are injectable have to be administered by the trained person. Then the dose adjustment. As you know, the in the liquid, the drug is distributed or drug is solubilized. If you say 5 ml of the dose contain 100 milligram of the drug. So if you decrease the volume of your dose, you can reduce the amount of drug which you are giving to the patient. So if you want to reduce the dose from 5 ml, you can give 2.5 ml, and from 100 milligram, you can give 50 milligram. So that dose adjustment is possible for liquid dosage form. Sometime in case of tablet, if you break the tablet, the breaking is not allowed if they are special coating tablet, and sometimes breaking may not ensure that the tablet is divided into equal parts. So again, the dose adjustment for the solid dosage form is not possible. But the varying the volume, you can adjust the dose. Now you have manufacturing. In case of solution, it is just simple solubilizing the ingredient into the liquid or solvent. So by just mixing ingredient into the suitable solvent, you can prepare the solution dosage form or absorption. As you know, the liquid dosage form, the drug is in a dissolved form and it is readily absorbable. If you consider tablet or capsule, first it has to disintegrate into stomach. Then from that disintegrated particle, you have the drug to be dissolved or diffuse out from that particle, and then it is available for the absorption of the drug. But in case of the liquid dosage form, the drug is already in the dissolved form and it is readily available for the absorption. So absorption is faster as compared to the other solid dosage form like tablet and capsule. Now, various disadvantage of liquid dosage form. First is in dose accuracy. Okay, so dose accuracy, the tablet and capsule, individual tablet, individual capsule is given to the patient. It is packed into the strip or the blister. But in case of the liquid, you have spoonful to be given or 5 ml, 10 ml, like that the dose is set. So sometime patient, instead of taking one spoonful, they may take two spoonful, they may take half spoonful. So, and even sometime patient take the liquid dosage form like drinking water. So that may lead to the inaccurate dose delivery to the patient. So that is one disadvantage with the liquid dosage form. Either you may have less or more dose delivery to the patient. Non-uniformity of dose. Now your liquid dosage form are of various type. They can be solution, suspension, emulsion. Okay. So if in case of the solution, your drug is in dissolved form, it is homogeneous, uniform. But in case of the suspension, the drug is not in dissolved form, it is suspended or dispersed throughout the system. The formulation has tendency to settle down, and if you do not check the container well, it is not getting distributed. And if you take only upper supernatant part, you will have less drug content, and the lower part will have more solid content and more drug content, and it may be the overdose delivered to the patient. Next you have is the microbial contamination. As you know, liquid dosage form, because they contain water and any other liquid, they are more prone to growth of microorganism because water act as a good media for the growth. Okay. Then you have transportation and packaging. The transportation and packaging, the liquid dosage form, the containers which you use are big in size. Okay, tablet you have strip, you have a blister, but the liquid you have to pack into bottles or vials or drop bottles. So these are some big container and hence it becomes bulky to handle. So handling becomes problem, the transportation become problem, and sometimes the glass container have chances to break during the handling, and hence the transportation and packaging becomes difficult. Then unstable and incompatibility. If you compare the stability of liquid and solid dosage form, because they contain liquid, they are unstable as compared to the solid, and the incompatibility reactions are more in liquid state. So you have more incompatibility in liquid dosage form. As you know, the liquid dosage form also contain many additives or other excipients. So when you increase number of ingredients, the compatibility reaction between these ingredients also increase, and hence they have more incompatibility as compared to the solid dosage forms. Now, one more disadvantage is manufacturing for biphasic liquids. Now, simple solutions are easy to prepare. You have to mix the ingredient, solubilize it, you may filter it, and then you have to pack it. But in case of biphasic liquid dosage form like suspension solution, you have to you have many steps involved in the preparation. You have to mix the ingredient, you have to properly disperse the ingredient, you have heating, mixing, filtration, you have homogenization, that is the uniform mixing of whatever liquid dosage form which you have prepared. So there are many multiple steps are involved in preparation, and these steps are not easy, and hence it becomes difficult in manufacturing for some dosage form such as biphasic, suspension, and emulsion. So these are some disadvantages related to the liquid dosage form. What are the different route of administration used for the liquid dosage form? So various routes which can be used, you can see here a narrow mouth container solution is filled. It can be given by oral route. Then some solutions are applied onto the skin, that can be used as a topical route. Then some one dropper is here. You have drop which can be given by orally. Drops are instilled into the eye, nose, ear, so they are also topical use. Then you have ampule, which is injectable, so you can give the parenterally, intramuscular, subcutaneous, intradermal, intravenous injections can be given for the liquid dosage form. So oral, parenteral, and topical route can be used. Then you have labeling directions. So labeling directions, if it is oral formulation or for internal use, you have to label the content of added drug into the formulation. So you have to write the total content of the formulation and dose in each 5 ml or 1 ml you have to mention. If you have added any preservative or coloring agent, flavoring agent, you have to mention those coloring agent or flavoring agent. For alcohol content, you have to mention the alcohol content. If the drug is for external use, then you have to mention the content of drug in terms of percentage. Then how to use it, whether you have to apply it, you have to instill into the cavity, that you have to use. If it is for external use, you have to mention the external use only. Then lay storage condition, you have to mention whether you have to store away from light in cool dry place, or if drug is temperature sensitive, at particular temperature you have to store, that temperature you have to mention. And if it is ophthalmic preparation, you have to write some special direction like to be discarded after 1 month from opening. If it is oral cavity topical preparation, then not to be swallow, because mouthwash, gargle, throat pain, throat sprays, these are the formulations which are not for swallow. These are only for the oral cavity action. So these directions you have to write. Container closures, you can see the narrow mouth plastic bottles or glass bottle with the measuring you device. Okay, this measuring device is coming to measure the volume of liquid to be taken. Then the glass bottles, then vials and ampules are used as an container closure for packing of the liquid dosage form. Then you have various advantages, disadvantages, which we have seen in the last slide, and various examples we will see into next slides. Now, liquid dosage form classification. If you see classification based upon use, they are either internal use, external use, or the parenteral use. So, internal use formulations are taken orally, they go into your digestive tract, they enter into your stomach. External use formulations, they are used for topical formulation. So many drops which you instill into eye, ear, nose cavity, then many formulations which you apply topically on mucosal membrane are also for external use. Use in mouth cavity like gargles, mouthwash, paints, they are external use. So external use formulations which you instill into body cavity like eye, ear, nose, vagina, then onto your skin and into your mouth cavity, these are the external use formulations. Parenteral use formulations which you directly inject into the blood circulation. So various subcutaneous, intradermal, intramuscular, intravenous injections are the parenteral use formulations. Now, based upon phase, whether it is monophasic, biphasic. Monophasic means only one phase exhibit. It is a solution formulation. The uniform mixing is there. System appears homogeneous. In case of biphasic dosage form, you have two phases which are mixed together. So suspension and emulsion are the example of biphasic dosage form. In case of emulsion, the drug is mixed into oil and water by using of the emulsifier, and they are making one phase. So suspension and emulsions are example or biphasic liquid dosage form. Monophasic liquid dosage form, if it is for internal use, you have solution, you have syrup, linctus, aromatic water, drops, elixirs, mixtures, and draughts. These are the various examples of monophasic internal dosage form. Monophasic external dosage forms are the mouthwashes, gargle, throat paint, various drops which you use for ear, eyes, nose, various sprays, then douches, enemas, various solutions which you apply on skin or topical application, then lotions and liniments, these are for the external use. And parenteral use, these are various aqueous injections or various oily injections also are the parenteral formulation which are liquid dosage form. And in case of biphasic dosage form, you have emulsion, and emulsion which can be used for internal purpose or external purpose. So various emulsions which you take orally, these are the internal emulsions, and when you apply those emulsions onto the skin, they are external use preparation. Suspension also internal use and the external use. So whenever the suspension formulation prepare and you take it orally, it is internal suspension. And any suspension formulation which you prepare, you apply topically on skin, then it is external use suspension. Next you have is based upon whether they're aqueous or alcoholic or hydroalcoholic. You know that the solvent system may be aqueous, but if the drug solubility is less, you can use the alcohol to make it solubilize. So in case of aqueous, you have solution, various syrups, linctus, drop, mixture, gargles, throat paint, sprays, douches, enemas. These are some examples which come under aqueous solvent system or aqueous vehicle system liquid dosage form. And in case of the alcoholic or hydroalcoholic, you have elixir and spirit. Key points to remember for liquid dosage form is what is the definition of the dosage form, which are the route through which you can use the dosage, liquid dosage form, advantages and disadvantages, packaging, container closures, labeling directions, storage condition, the classification based upon their use, based upon their phases, and the various formulation excipients which you use for the preparation of the liquid dosage form. Kindly like, share, subscribe my channel and enjoy learning. Keep growing with Why Not Pharma. Thank you very much.